This is how the patient should look after they are fully set up. You have the arm cuff on one arm and the finger cuff on the opposite arm. You have the chest bellows, as well as the 3-lead ECG all hooked up. Now you're ready to start performing the tests. Now that the patient is all hooked up, we will have them start the heart rate deep breathing maneuver. This test takes 1 minute and 20 seconds and consists of 8 sets of breaths with a 5-second inhale and a 5-second exhale. The patients do need to be able to see the HRV acquired here, so they are able to follow the patient cue and get good timed breaths. I will now start the test.
We'll now begin the heart rate deep breathing maneuver. In order to do this, we will choose our patient, and then we will click on the heart rate deep breathing logo in the top left corner up here. We will then see a screen that pops up that will confirm our patient. If that is correct, we're going to hit save. Now the test pops up. To start the test, we're going to go to the upper left-hand corner and click Start Test. Once we click Start Test, you should see the heart rate, the blood pressure, and all other signals start to appear in the software. Once you are ready to begin the maneuver, which is usually after 1 minute or 2 minutes of pre-recorded data to get a baseline, we will click this Start Stop Metronome button. Once we click that button, the metronome on the HRV acquire will begin. For the heart rate deep breathing maneuver, that is going to be that arrow that appears on the HRV acquire, and it will move upwards as the patients inhale and downwards as the patients exhale. This will be 5 seconds of an inhale and 5 seconds of an exhale with a repetition of 8 times for a total test time of 1 minute and 20 seconds. Once we click Start Stop Metronome, we will see the screen on the software will automatically mark, noting that we have started the test. And at the end of that 1:20 test, it will automatically mark again, showing that we have finished that test. Once we're ready to begin, we will click that Start Stop Metronome button. At the end of that test, we will see, like we see here, another mark indicating the end of that test. Once we are done with that test, we are going to hit Stop Pause Recording. This pop-up menu does come up. We will hit Finish Test, and then we will hit Save Test. Now is when we can start to do the analysis. Here is a good example of what your heart rate deep breathing maneuver should look like after 2 tests.